this introductory lesson is all about taking just a few minutes to try to improve chronic lower back pain. And this is a very sensitive and important subject. A lot of people suffer from this. And my assumption going into this is that you have chronic back pain and that the pain is pretty bad. So I'm just going to take a few minutes to show you a few things that you might do to ease your pain. So we're going to start with very minimal movements. There will practically not be a lot of movements. And the reason that is that what we really want is for your nervous system to relax. Now, your nervous system, when you have chronic pain, knows that there is an area that is problematic, and it often contracts in anticipation. A lot of muscles start to work that actually don't need to work. And we want to kind of help ourselves and teach ourselves how to let go in that area and enjoy, even if it's a tiny movement. This already can soothe your nervous system and can even decrease the pain. So let's start. So what we're going to do, we have this little thing that I'm going to show you later. So you just lie down on the mat. My assumption is that you have a lot of pain, so you will probably not be able to stretch out your legs, and that's totally fine. So you just lie down on the mat. It can also be your bed. If it's hard for you to get on the floor, you can use your bed. I tried it and it works quite nicely. So you just put your feet in a place where it feels very comfortable, and then give yourself a second to notice how your body is lying on the floor. What feels heavy? In other words, what are you letting go into the floor? And then notice maybe where you're not letting go completely, where there is a little bit of tension or maybe even discomfort. Just take a minute to breathe and to feel yourself lying on the floor with your feet standing. And now maybe we want to add another level. So the first level is of awareness is to feel how you're lying on the floor, you know, and where maybe there's tension or what feels good and what feels heavy. The next level of awareness is to notice how is your head lying on the floor with relation to your shoulders. Do you feel that your head is tilted to one side or to the other? Notice your shoulders, how your shoulder blades are touching the floor. Notice the curve of your neck, those vertebrae that are not touching the floor. Notice your back, your spine. And then notice if you can imagine, or even if you can feel the curve of your lower back. And now just focus your breathing on your lower abdomen. So I'm putting my hands on my lower abdomen so that perhaps if you need to look at it, you can see approximately where that would be. It's the area around and below your belly button. And you want to just breathe into that area. Because when we have lower chronic back pain, we contract this area. Because what we're trying to do is we're trying to flatten the curve, the lumbar curve. Because being in that curve, that can hurt. So we tend to contract these muscles. We have 3 layers of abdominal muscles, and they are powerful. So when we're always contracting these muscles, it starts to get hard to release them. So why don't you try and breathe and try to let your stomach, your abdomen be relaxed. So you just want to breathe into your lower abdomen a little bit. And sometimes I notice with students this is hard for them to do. They're breathing into their chest, and that's fine, but just keep trying. Just keep trying and see if you can let this area be open, and let the front line of your body, the front line of your upper body, let it be, perhaps feel how it can elongate as you breathe. So if you were to put your hands on the notch between your claviculars, between your collarbones and where your pelvic bone is, and you breathe in, you might feel that this lengthens, it opens. Now, as you do this, you might notice that there is a tiny movement in your pelvis as you breathe in. If your abdomen kind of comes out a little bit, comes up a little bit, it can slightly, incrementally open the curvature of your lower back. So just see if this is happening. It might not be happening, and that's fine. Your body is protecting itself and it's protecting you maybe from something it doesn't want to do yet. So it's very important to listen. But if you can, just breathe into your lower abdomen. And then you might want to just very slightly, but really slightly, make this movement, your breathing movement, a tiny bit bigger so that your abdomen is starting to very slightly move a little bit. There's a tiny tilt in the direction of your feet. And as you breathe out, the tilt kind of releases. I'm putting my fingers on the hip bones that stick out, okay? And just, it's so small that one would probably not be able to see it unless you're really looking for it. You just do that. So you think of the front of your body being long, and perhaps if you can have a tiny, tiny tilt. We're talking a few degrees, so that actually your iliac crest, the hip bone that sticks out, those two hip bones, they come a little bit further away from the your lower ribs, okay? So the lower ribs, you can feel them, of course, and your hip bone, and you want to think about gently, gently opening, just opening that space. And you can do this in sitting. It's a wonderful exercise. You can do that in sitting. It can be tiny, but it's effective. And if you feel up to it, you might just want to start a tiny bit playing with that tilt in your pelvis, where once you breathe in, your pelvis slightly tilts away from your chest, and as you breathe out, it comes back. And now bring your awareness to your sternum. Not your sternum, sorry, your sacrum. My mistake. So you feel how the sacrum, which is this part, you just keep going, this part of your lower spine, so this is the spine from the back, this is your sacrum. Those are the vertebrae that are fused. They don't have individual movement, and you feel how those are moving on the floor. You bring your awareness to that area, and as you are either just breathing or even tiny, tiny tilts with your pelvis, you can feel that that area, those bones, are getting a tiny bit of a massage. Okay, that's one. And then the other thing is, we would like to move our pelvis, not just tilt it up and down, we can tilt it to the side. So you could just gently, gently lift, and I'm talking about maybe 2 centimeters, which is what? Half an inch or a little bit more than that, yeah? So you're just making tiny to little, you lift one corner of your pelvis, and you feel that the other corner of the pelvis is pushing into the mat or into your bed, whatever it is. You just keep kind of tilting your pelvis now from side to side. Very small movements. Again, you want to make movements in such a way that they're so small that your pain will not wake up. And this is very pleasant because, as I said before, your nervous system knows that there is pain there. So you want to like really make it very small. Notice that your breathing is easy and flowing. Notice that your jaw is relaxed. And then take a rest. Take a rest, and if you can, you may want to, a lot of people can't do this when they have chronic back pain, but you may want to straighten one leg. But if you do decide to straighten a leg, make sure that there is always a contact with part of your foot or your heel with the floor, so that this opening comes very slowly. I see people kind of throwing their legs on the floor, like lifting them and throwing them straight on the floor. That's not good for your hip joint. So if you slowly stretch out your leg, when your heel is still in touch with the floor during the entire lengthening of the leg, then that opening in your hip joint is smooth and slow. So I'm going to do this, but that's not a problem for me. That doesn't mean that you should do this. I'm going to take a rest, and I want to take an opportunity to see how my body is lying on the floor now, if maybe there's a release somewhere, or something feels heavier or better. All right. This might be enough for you, but if you want to also do one more thing, I wanted to introduce you to this little amazing tool. So this is just like a regular little exercise ball. It's like a soft ball. You can buy them anywhere. And the trick is that you take out most of the air. So you take out that little plastic and you take out most of the air, but it looks empty, but it's not. So there's still some air in there. And it's important for you to play around to see how much air you need and what is good for you. And then you might want to just put this air disc, you can think of it as a big disc of air. Make sure the plastic on the side so it won't poke you, and put that under your lower back. And again, if that doesn't feel right, don't do it. If it doesn't feel good, take it out. So you just put this little support under your lower back into the curvature of your lumbar spine. So we talked about that also in better sitting. And now you can just kind of very gently experiment these little tilts we did before. You can do them now, but now you have an extra support. And what's unique about that extra support is that it moves with you. And again, if you feel a tiny bit of pain or discomfort, take it off. Might not work for you now. Might work for you in a week or two. So you just kind of tilt your pelvis. Notice that I'm not really moving my knees very much. And you can tilt your pelvis up and down a little bit. And to the side, and if you feel like it, you can make some small rotations with your pelvis. See what it feels like. Change the direction of the rotation. And think about your abdomen being free and soft. And think of the front line of your body being long. And so you really want to play with it the way that suits you. Then you can take out your little support. And when you do, you will feel that your sacrum is really clear on the floor now. All right? So that's it for a little introduction on how you can help yourself with lower chronic back pain.